emphasize this enough. This is a critical next step to avoid closures. We want to stay open and we need to stay safer. In fact, this is an opportunity for you to patron your favorite local businesses while being a whole lot safer. So you can go out to eat knowing that the people around you have been vaccinated or have received a negative test within the last few days. I want to see more people certainly supporting those local businesses because they've been through so much. And at the same time, we as a city, we must stay safe. We all have a role to play in ensuring that this policy can help curb this surge in cases and keep our city moving forward through this phase of the pandemic. A huge thank you to all of the health workers in our departments, our community planning and economic development department, and so many staff that have helped and worked tirelessly to make sure that this policy is done right and fits. And it is, in fact, a best next step for our residents and employees and visitors to stay safe. Appreciate the time. And with that, I will hand it over to Mayor Carter, who has been a partner and leader in these efforts, and so very appreciate the partnership in our Twin Cities. Mayor Carter.
Thank you, Mayor Fry, and thank you all for joining us today for this important announcement. No one needs to know, no one needs to be told that we are still in a global pandemic. No one needs to be told that this pandemic has had significant and dire impacts on our entire community in the form of lives lost, in the form of economic challenges created for community members at all levels, all across the globe. And no one needs to be informed today that our healthcare workers, our doctors, our nurses, our essential employees, our public employees have served vital services for us and provided heroic leadership for us to fight us through this pandemic. What they need from us, what they deserve from us is not just our thanks or our bumper stickers or our status updates on social media. What they deserve from us, what we owe them, is to take every step that we can to be able to fight the impacts of this growing pandemic. As I hear people ask, is this like the first phases? And as we reflect on those first phases of this pandemic, this shutdown our economy that impacted us so greatly, we know that the big difference between those early stages of the pandemic and today is that we have more tools in our toolbox than ever before. We're not helpless against the ongoing impacts of COVID-19. Together, we can help prevent the spread and ensure that we can all be a part of the solution of fighting back to reclaim those aspirations we have for our community. It requires us to all do our part to ensure that everyone eligible gets vaccinated, to continue to mask. And so today we're taking another important step in our fight against COVID. The city of St. Paul, like Minneapolis, will institute a proof of vaccination or proof of negative PCR test for licensed businesses where food and drink is sold or served indoors for consumption. This order for St. Paul will take effect on January 19th for non-ticketed events and January 26th for ticketed events. While this is a tool no one ever wants to have to use, amid these ongoing concerns that we hear from public health professionals and amid the staggering increases we've experienced in case counts, we must continue to leverage every tool we have available. Only by working together can we all help prevent the spread of COVID, conquer this together, and keep our economy moving forward together. We're not helpless against this. Let's use this tool to ensure we can continue moving forward through this pandemic. Thank you very much. And I believe I'm passing it forward to Heidi Ritchie.
Thank you, Mayor Carter and Mayor Fry. My name is Heidi Ritchie. That's HEIDI-RITCHIE. I'm the Interim Health Commissioner here in Minneapolis. We've seen the Omicron variant has wreaked havoc on our transmission rates in Minneapolis and the region and the state. We know that the Omicron variant is more transmissible. It's twice that of Delta, and Delta was twice that of the original strain. We've seen higher infection rates amongst young children, with increased cases in children 4 and younger since mid-December, rising 27% compared to children 5 and older. This is likely due to that age group not being able to be vaccinated. We've also seen cases tripled since mid-December. Our 7-day new case rate was at 320 cases per 100,000 on December 13th. And now it's at 1,353 per 100,000 as of January 3rd. Our hospital capacity is strained. A snapshot from today's metro area bed capacity shows very limited beds in all of the units, including adult ICU, medical surgical, pediatric ICU, and others. We're seeing pediatric admissions increasing, especially amongst the age group I mentioned before, those who are unvaccinated or under-vaccinated and under age 5. But vaccinations are helping keep children out of the hospital. In looking at other cities and states, they have also begun implementing or re-implementing mask mandates and vaccine requirements, in particular for venues that serve beverage and food. In cities that have implemented these, we have seen results. For example, in New York City, they went from 70% adults with at least 1 dose before the vaccination requirement in mid-July to 90% by December 10th. In Philadelphia, they put a requirement in for congregate care facilities in August. Those facilities went from 64% to 94% vaccination rate. In other cities, we've seen mask mandates help flatten the curve and help prevent a collapse of our healthcare system. The vaccine mandate will help build our immunity wall in Minneapolis, and with the help of St. Paul, the region, and with the help of other cities and cities that I hope follow the lead. And to that end, I am happy to be collaborating with St. Paul, and again, encourage other cities to do the same. Thank you, and now I'll turn it over to Eric Hansen, the Director of Economic Policy and Development here in Minneapolis. Thank you.
Thank you, Commissioner Ritchie, Mayor Fry, and Mayor Carter. My name is Eric Hansen, E-R-I-K-H-A-N-S-E-N. And as Heidi said, I'm the Director of Economic Policy and Development within the city's Community Planning and Economic Development Department. And I just want to echo some things that I heard from both mayors this afternoon about where we were 2 years ago. The shutdowns that we experienced, at least in Minneapolis, closed about 1,700 businesses. And those business shutdowns translated into about 140,000 plus people looking for unemployment benefits. And the city of Minneapolis is still recovering from that economic impact. As of December, our friends at the Downtown Council, who tracks this data, report we're only back to about half of seated diners from pre-pandemic levels. So this is a critical time for our business community. We've had our theaters and our venues closed. They're the first to close and the last to open. And we are very interested in keeping all of those businesses open. As a community, we have to adjust to figure out how to live with this pandemic. This regulation, we believe, helps protect the health of the business owners, the workers, and the patrons alike, while keeping these important businesses open. And we remember how important these are to our quality of life when they closed. And so this regulation, we're hoping, coupled with the mask mandates and other public health initiatives within Minneapolis and St. Paul, will help keep those businesses open. And so I echo both mayors Carter and Fry. Please remember these businesses are open. Please do patronize them. And it's a very critical time in the pandemic. So we worry about the workers, we worry about the business owners, and we worry about the community's quality of life, both here in Minneapolis and our neighbors in St. Paul. With that, I forget who I turn it over to.
We'll turn it over to Jonathan Weinhagen,
Right.
the Regional Chamber of Commerce.
Good afternoon, mayors. Thank you for having me this afternoon. Jonathan Weinhagen, President and CEO of the Minneapolis Regional Chamber. Certainly appreciate the opportunity to share a few thoughts about how our business community is coming together to support employees and our businesses throughout this pandemic. Important to note, as you've heard already today, Minneapolis and St. Paul are open for business, and we want to keep it that way. As difficult as the past 22 months have been, I've spoken with countless workers and business leaders who have found their relationships strengthened by working together to overcome the hurdles that we've all faced. While the information overload that has come with COVID-19 is real, one thing we do know is that testing, vaccines, and masking are the very best tools that we have at our disposal to mitigate the impacts of this virus and to keep our economy open. Nothing is going to entirely prevent the spread, we know that, but we can take actions that will help protect ourselves and others. Businesses were facing strains on their workforce long before the pandemic began. Having several employees sick, or worse yet, hospitalized, makes it tough for any type of business to stay open and productive. We want our employees to be as healthy as possible. We want to keep the economy going. And it's clear that the next few weeks are going to be difficult, as virtually all of us know someone who has been infected or contracted COVID-19 recently. I include myself and my wife in that group. Over the holidays, we had COVID. Fortunately, our symptoms were moderate, and our 19-year-old special needs son, who is immunocompromised, did not contract the virus. But we also know that in some cases, the illness continues to be serious, and the sheer number of people catching it is impacting everything and everyone. And you heard about the strain on our hospitals, and I hear that from hospital executives every single day. I hope that everyone will show kindness, especially to our healthcare heroes and to our frontline workers, including those in the hospitality sector, as we work through this phase of the pandemic together. I'm confident that through all of this, as cities and as a region, we will come out stronger, and we will do that together. Thank you, and I think I'm turning it back over to Mayor Fry.
Thank you so much, Mr. Weinhagen, and thank you for being here. With that, we will open it up to any questions that you may have.
And Mayor Fry, this is Sarah McKenzie. I'm going to call on reporters that have RSVP'd to me. So I'm going to start out with John Collins from NPR to see if he has any questions.
Yeah, thanks so much for taking my question. I want to get a little more clarity on what sort of events are covered here. You said all places people eat or drink. Does that include, say, stadiums and things like that?
Thank you for the question. Yes, it would include stadiums if food is consumed or drink is consumed indoors. So that is the key facet there. Mayor Carter, feel free to add on anything, and then we can certainly turn it over to our resident experts as well.
I'm happy to turn over to resident experts.
Yeah. Mr. Hanson?
Yes, sir. We'll have articulated a number of venues that would qualify, but to what Mayor Fry has said, if you're serving food or beverages indoors, you're going to be subject to this proof of vaccination or showing the negative tests. There are some places where, so those are like indoor restaurants, coffee shops, cafes, bars, sports venues, theaters, bowling alleys, convention centers, and like catering halls. There are some areas that wouldn't be apply to this, like schools or hospitals or congregate care facilities. We have, if there's like areas that aren't really connected to a restaurant or a bar where people might sit down, if people are brown bagging it somewhere downtown, you're not gonna have to show proof of vaccine. If you're just grabbing food and going, you wouldn't have to. So those transient actions, and so you come in, you grab some food, and you leave, and then just general retailing facilities like grocery stores or hardware stores, those sort of things would be exempt as well. So I hope that answers your question, sir.
Yeah, that's great. Thank you.
And Mr. Hanson, if you could go just a little bit further as well and explain how this would apply to, for instance, a Skyway system, how this would play for places of congregation that aren't necessarily connected to a restaurant or bar.
Yeah, so there are areas, like I said earlier, where you might be able to sit down and eat, whether that's takeout, whether that's something you've taken from home, and it's in an indoor facility. If it's not exclusive to the restaurant or a bar or the place that served the food, then it wouldn't qualify. And really, it comes down to being able to enforce people just hanging out in the skyways or in larger, congregate areas that have maybe tables but not really a specific connection to a specific place of accommodation.
All right, now I'm going to call on Liz Navratil of the Star Tribune.
Two sets of questions for you. One is, how are the cities defining vaccinated? Does that mean they had the initial round of shots, or do people need proof of a booster as well? And separately, can you provide more details on what types of COVID tests would and wouldn't be accepted, and what counts as adequate proof of a negative test?
Yes,
Yeah,
so
absolutely. I can. Oh, go ahead.
go ahead.
Yes, we obviously, to have a enforceable policy, we need a verifiable test. So in that regard, there's not a way to include home exams where that's concerned. We understand that there is a challenge and delays in getting PCR exams and lab tests, which is why we included the 72-hour window to allow for that. I'm sorry, what was the other part of the question?
How are the cities defining vaccinated? Does that mean people had just their initial 1 or 2 shots? Or do they need a booster?
Yes, we're defining vaccinated as needing the original course. That may be something we'll have to revisit over time, but at this point, it defines it as the original course, whether that's 2 shots of a 2-shot sequence or 1 shot of a 1-shot sequence.
All right, Liz, did that answer all your questions?
Yeah, if I could have our health department director just chime in as well regarding both the testing, just to give a full explanation, as well as the vaccination as well.
Happy to. So a person is considered fully vaccinated 2 weeks after receiving the second dose in a 2-dose series of an approved COVID-19 vaccine, or a single dose in a 1-dose approved COVID-19 vaccine. In terms of the testing, in the emergency regulation, we are requiring a medically supervised test. There's really no way, if you're taking a rapid test at home, to be able to match up the results with the actual person taking the test. It's very easy to take a picture of the strip that is your testing result and share it with other people, or put it on Facebook or whatnot. So we really want the test to be medically supervised to make sure that the person who indeed is receiving the negative test result is the person who took the test.
And Commissioner or Interim Director, the test could be a PCR, assuming it is supervised in person, as well as an alternate?
That's correct. So we would accept the PCR test, which is the saliva test, or the antigen test, which is the rapid nasal swab test.
And just to confirm, is that the same in St. Paul, that you guys would also accept both PCR and antigen?
I think Mayor Carter, you're on mute.
Yes, we're required. We will accept the PCR or antigen as long as that's a lab test, a verifiable lab test.
Okay, now moving on, checking on to see if Tori Van Oot or Nick Halter are on from Axios. And if you have any questions. Okay, how about Rob Olson of Fox 9?
Yeah, a question, and this could be for anyone from either city, is how is this enforced? Is there any kind of repercussions if you find any establishment not enforcing these regulations? What happens then?
Thank you for the question. The intent here is not to go in with a heavy hand. The intent is, again, to allow our businesses to stay open while keeping people safer. And again, I think this is more of an opportunity to patron some of your businesses with more of an understanding that the people around you will in fact be vaccinated and or have a negative test within the 3 previous days. But as far as enforcement goes and how it'll function, generally it is complaint based, and I'll turn it over to Mr. Hansen, who can give a fuller explanation.
All right. Thank you, Mayor Fry. We would go through a progressive enforcement, but to the mayor's point, we're trying to work with businesses to make this as smooth as possible. So one of the things that I would say is, if you're coming downtown, you're coming to a restaurant in the neighborhoods, you're going to a show, you're going to go see the Timberwolves, please get your vax cards. Please go get vaccinated. It's the easiest way to get into a business. And if you have a negative test, that's also acceptable, but let's try and be as compliant as possible to make it easy on the business owners. This will require them to have additional procedures and processes in place in order to check these cards to make sure that they're being safe and following this regulation. But if we hear violations, if there are violations, it's the 311 system is how we will collect them, and our appropriate departments will then work with those licensed businesses to see what kind of enforcement is necessary. So it usually starts with like a warning letter, and then it progresses from there.
I think it's important to note too, though, that these requirements are built it just as much to protect those same businesses that we're talking about right now, many of whom are trying to figure out how they make it through another spike, and know that we have to all chip in and do our part to avoid the type of shutdowns that COVID required from us just under 2 years ago at the beginning of the start of the pandemic. And so, to Mayor Fry's point, our expectation is the vast majority of businesses will comply, will participate, and will see this as an opportunity to keep their business open, to keep their employees working, and to keep our whole community moving forward together.
Okay, do we have Brianna Kelly from the Business Journal? Or John Simon from KARE 11? Or Brianna Levine from WCCO? I'm just going to move on to some of the questions that are in the chat here. I see that Blois Olson has asked, when does the mandate expire?
Thank you for the question. It is, when does the mandate expire? There's not an explicitly listed expiration date within the reg itself. That being said, this should be temporary. If we're listening to the epidemiologists, and we are, if we're listening to the experts, and we are, there is the full spike that's expected in the next several weeks. And I think people are already seeing that right now. We're also noting, however, that the Omicron variant, while it is very contagious, it's significantly weaker. And the hope is that we're on the final stretch right now, and the final stretch is painful, it is tough. I recognize that people are reeling right now, but this is a mechanism to get through this together. This is a mechanism to keep moving as our twin cities, as our state, and simultaneously help to keep people safer than they otherwise would be.
All right, I see we have another question too from John Collins. What sort of proof of vaccine is required? Does it have to be a card, or it can be a photo?
Sarah, can I jump in there before we move on to the next question? And that is this.
Sure.
For my executive order, it has a horizon of 40 days. So as of that point, we would have to take stock with our public health professionals and community members and determine what our whether we would renew that or alter it or completely or pull it back at that point.
All right. Can we go on to that? The next question again, then, from John Collins, asking again, what sort of proof of vaccine is required? We want to go over that one again.
A vaccine card is a possibility. The Docket app is a possibility. I also know that there are other communities around the country and around the world who have developed pretty convenient kind of one-stop mobile apps or technological solutions to provide a seamless kind of seamless verification in a way that helps reduce the burden on private businesses and event managers. That's something that we are looking into, and so we'll hopefully have a determination in the coming days and weeks if that's something we can sustainably pursue with regard to St. Paul and Minneapolis.
Okay, question from Jack Mulmud here. Is there a plan if delays in PCR testing continue? Some wait times are as high as several days. Would there be any adjusting of the 72-hour window?
I'll pass it to our Interim Director of Health, Heidi Ritchie, who can also provide a bit of analysis on the last question as well, which is what form of proof. There's a question of what form of proof are we supposed to provide with the vaccines?
Sure, thank you, Mayor, and thank you for the question. I'll just go through the proof that may be demonstrated, an official vaccine record, a photo or hard copy of the CDC vaccination card, the state of Minnesota docket app, which Mayor Carter mentioned, a private third-party application designed to allow people to upload and save their vaccination card and negative COVID test results, or a photo or hard copy of an official vaccination record of a vaccine administered outside the United States, or one of the following vaccines: AstraZeneca, SK Bioscience, Serum Institute of India, Covishield, and Vaxzevria, Sinopharm, or Sinovac. And then the question about PCR tests and delays, here's what I will say about that. This is designed to incentivize people, motivate people, and promote the vaccine. So if we've got testing delays, just to repeat what Director Hansen had mentioned, we really want to see people get that vaccine. That's going to be the easiest way for you to get into these events and make sure that we're as safe as possible. I'll also keep in mind as these delays, if there are PCR delays, there's still that antigen rapid test that can be taken. When you get to delays of like 5 days or more, then you've got more exposure between the time you took the test to the time you get the results. And so really, again, we want to see the vaccine, and we want to see people who are negative tested within a smaller window than a larger window because of the increase in exposure when you've got that window increased.
Commissioner Ritchie, can I add Mayor Carter, Mayor Fry, Sarah Holly, I'm St. Paul Ramsey County Public Health Director. I also just want to add to what Commissioner Ritchie just mentioned, that we are working very closely with our state partners to ensure that we have adequate community testing, to the question around the limitations that we're seeing in testing and also the long wait times and people receiving results and seeing those delays. So just a reassurance here that we continue in local public health and both in our county and city jurisdictions to continue to work on how we can adequately provide community testing across the state. Thank you.
All right, now next, Katie from the Star Tribune. Will there be an exception made for those who cannot get vaccinated for religious or medical reasons?
That is part of the reason for the testing option as well, so that folks who cannot get vaccinated for religious or medical reasons have the availability to take a test and still continue to participate in our economy and social events.
That's right. And additionally to the last question, this was noted by Commissioner Ritchie, but to the extent that there are delays, there is the option for the antigen as well.
Okay, a couple more questions here from Liz Navratil. Can we clarify one part of enforcement? Who gets penalized? The business who doesn't screen people adequately, or the people who try to enter without providing proof of vaccination or negative tests? And what are the possible penalties?
Mr. Hansen?
Yes, sir. Just turning on my camera. So it's a regulation to the business to comply with making sure that their patrons have shown proof of vaccine or proof of the negative test. So that is the burden is on the business owner, and that's the relationship the city has in this case around their business license. So it's our business licensing group and our health department that would work with the business. And it starts with, as far as what is, the violation enforcement. First, it's a warning and working with the businesses. So again, I got to reiterate that we're trying to work with the businesses around compliance. That's our first action that we want to take. But if it becomes that they're non-compliant multiple times, it will step up to administrative citations, and it could be a misdemeanor at at the very end. But we work as hard as we can to get to compliance and avoid administrative citations as much as we can. And I see Mr. Cervantes has turned his camera on, so he might have some opinions about St. Paul.
Thank you, Mr. Hansen. And it varies slightly in St. Paul. I think education is the first step of any enforcement. And so we want to provide information to our businesses to make sure that they understand what is being asked of them, what is being required of them. We're looking at putting together a guide which might assist them in administering this requirement, as well as some documents that they might be able to use on their front door, as well as advice and putting this on their website, making sure that all their patrons understand what is being asked of them. In regards to enforcement, it'd be an investigation to determine whether or not they're actually requiring these proof of vaccination and or of testing. And then after that, there would be an official notice requiring them to do so. And if not, then it would result in some civil penalty. And in the city of St. Paul, we have a matrix that we operate under. And so it would be a level 1 fine in that regard. Right now, that level 1 fine is a $500 penalty. But again, what we've seen in the past through education and through supporting our businesses, we had very few businesses that did not comply. And that's what we're hoping here, is that with the help of the city, these businesses will be able to continue doing business in a safe and healthy way, protecting their patrons as well as their employees.
All right. Are there any other reporters on who haven't had a chance to ask a question that would like to at this time? Either speak up or put it in chat. Looks like someone was about, is that Tori Van Oot? No, let's see.
This is Rob Olson with Channel 9. I do have a question.
Go for it. Thanks, Rob.
How much heads up or consultation with the bars and restaurants and other businesses has gone into this? Have you made them aware of this prior to today's announcement? Any consultation with business organizations or chamber in formulating this?
Thank you for the question. Yes, we did undergo outreach. I'll turn it over to Mr. Hansen to provide a few more of the specifics, and then certainly to St. Paul as well.
Yes. Yeah, under the mayor's direction, we reached out to a random sampling of community-based business associations, property management organizations, business owners, in a variety of businesses to get some advice and counsel on this proposed regulation. As you would imagine, there wasn't a uniform response, but there was a lot of support for this to be the right thing to do with respect to that COVID is really impacting not only, the community, it's impacting their ability to continue to operate their restaurants or bars or venues. And they're very nervous that this could lead to, further shutdowns. So we've gotten some support. Again, it's a random sampling of folks, but we tried to make sure that we were talking to, people that have venues downtown, people that are out in the neighborhoods, have a racial, different racial perspectives and cultural community perspectives in that outreach. And I'll turn it over to St. Paul for their comments.
Similarly, we did outreach to small business owners and larger kind of venues alike, having conversations with them. I think both Minneapolis and our order have shifted fundamentally with regard to the feedback that we've heard. One such request was to consider a testing option, which of course is considered and is included in this. That is in direct response to some of the feedback that we've heard from businesses of all sizes. And we've heard the same thing that Mr. Hansen just described from a significant number of business owners who would reply that, while, we would all agree that none of us prefer or love or consider this to be an optimal scenario, that tracking the news, the statewide and national news about the Omicron variant and about the case counts across the country and across our state. I think folks indicated that, for the most part, that they weren't necessarily surprised that this conversation was moving forward, and that at some level having the consistency across the sector, across the industry, and certainly between the two cities. That's one thing that we commonly hear is a desire from our business community to see parallel policies moved across the Twin Cities, so they don't have to, adhere to one set of requirements in one city and an entirely different set in another city. So some of those things were responsive. That's one of the reasons why our goal is to be as aligned in the policy that we're moving forward as possible, and why we're making this announcement here together today.
All right. I'm seeing questions about age requirements in the chat as well. What ages does this apply to?
Yes, I've seen two questions in the chat here. One is regarding what form of proof that the vaccine must take. And you can have a photo of the vaccine card itself, so that is permitted, in addition to having the card itself. And then with regard to ages, I'll pass it to Director Ritchie.
Thank you, Mayor Fry. This applies to anyone that can be vaccinated, so children over the age of 4, so 5 and over. Children between 2 and under 5 are subject to the testing requirement, and then children under the age of 2 are exempted from the requirement.
Okay, and I have one more question here that was emailed to me from Tori Van Oot of Axios. She wrote, with 72 hours allotted for PCR and also breakthrough cases, how much do you think realistically this can really slow or curb spread?
Director Ritchie.
Thank you, Mayor Fry. Trying to get to my camera button. I think that we want to use all the tools in our toolbox in order to curb the transmission rate, also make sure that we're not overwhelming our hospital systems, and make sure that we're building our wall of immunity in the city and in the state. We know that the pandemic doesn't have an end date and it knows no borders. And so we want to make sure, again, that we're building this wall of immunity. And I see Director Hawley is also turned her camera on.
Thank you, Commissioner Ritchie. I'll just reiterate too that we know the CDC has reiterated that unvaccinated persons are 20 times more likely to die from COVID than those with a booster or receiving that 2-dose mRNA vaccine plus the booster. So this is the best way for us to continue to protect ourselves. And I'll just reiterate that the COVID-19 vaccine is an effective way at preventing severe illness still, right, from COVID-19 and limiting the spread of the virus that causes it. So as Commissioner Ritchie has stressed, this is one of our top mitigation strategies, along with those other things that we can do around masking and testing. So I just want to reiterate that this is one of our top ways to mitigate the risk and spread of COVID-19. And the fact that we're seeing across the United States approximately 95% of new infections in the United States, according to the CDC. And we're also seeing the US experiencing high levels of community transmission. And so, with the case rate being, 29% positivity rate, we have a 7-day, I'll correct myself, positivity rate of 29.3%, and then our case rate across the United States as of Monday at 1,422. And so we have a number of Americans, both locally and across the United States, that are being hospitalized due to COVID. So again, stressing the need and urge for people to get vaccinated is still one of our top priorities in local public health and across the state.
Okay, I'm going to take one last question here. I see from Liz Nevertell in the chat. How did you decide to focus specifically on places where people are eating and drinking? Why not include other locations with large crowds?
Thank you for the question. There are tools that Mayor Carter and I have access to. There are other areas that are largely outside our purview. And so we wanted to do what we could to keep people safe and to keep our cities open through what is inevitably and likely going to be a surge in the next several weeks. And these are the tools that we have at our access right now. Mayor Carter, feel free to add on, and then this is likely a question that will be passed to our attorneys.
Yeah, to attorneys, also to public health professionals as well. That's exactly what I was going to suggest.
I can say one of the reasons that that we looked at the eating and beverage establishments is because those are establishments where it's very hard to wear a mask. So as you know, we instituted a mask mandate, which is broader. In these areas, like I said, you go into the establishment and you're going to be taking off your mask so that you can eat or drink. And so there's more risk for transmission in those places because of that. So that's one of the reasons why we chose food and beverage establishments.
And I'll just add that to what Commissioner Ritchie just mentioned. These are highly congregate settings, right? They're public spaces. We have a lot of people gathering at one time. And so again, reducing that risk of transmission is really important as this virus is transmitted still through, an oral way. So I think it's just really important that we reiterate and stress the need for vaccine and also masking when we're not eating or drinking.
All right. Thanks so much, everyone, for the good questions. All our speakers, I appreciate it.
Thank you all.